From your education and career history, we can know that you still work as a doctor. To common people's understanding, doctors is a very high status and important occupation in China and also in Australia. So what is the major reason for you to move your research, your work, your career from the very shallow definition of doctors to this wide world of allied health?
Medicine has become more complex. If you think about what was available 100 years ago, penicillin wasn't there 100 years ago.
No.
So when someone had an infection, the things that we could do were very little. When someone had a heart attack, the things that we could do were very little. Now, as medicine has become more complex, we can save lives. We can do a lot of things, but one person can't do it. The doctor can't do everything. Medical knowledge is now very, very big. And so I might be very good at diagnosing something, and I might be very good at saying, okay, you have this problem, you need to eat a particular diet, you need particular exercise, but I'm not an expert on all the types of exercise, all the types of diet, etc., which is why we have nutrition dietetics as a specialty, allied health. We have exercise physiology as specialists in teaching people to exercise. They are all allied health professionals that are funded by our health insurance, and when referred, they are also funded by, in Australia, they're funded by Medicare. And so around the world, they're also funded to do all sorts of treatment because that is the best practice.
You mentioned nutrition.
Yes.
I guess nutrition, dietetics is also a very important profession in helping with public health in the modern world, because my mother got diabetes and also stroke. So I guess what she eats is very important to prevent and to deal with many kinds of diseases. In China, we have a saying that is 祸从口出，病从口入, which means the trouble comes out of your mouth, disease getting you from also your mouth. So what you eat is really affecting your health. So could you please a little bit about this program, a profession, dietitian?
So there are many, again, a variation of things you can do. There are people who study nutrition and focus on public health nutrition. So they are employed by government. So if you come and do the Bachelor of Health Science at our university.
It's also a 3-year program?
It's a 3-year program. And if you do a major in nutrition and maybe a double major in health promotion, you become very employable by governments because governments need someone to design programs for communities and all the education for communities about what is good nutrition. And so people who have a health promotion background will also help design the campaigns around, for example, hygiene, exercise, all of those sorts of things. We make sure that they also have placements, so our students will get to work in government and non-government places, so that they will feel confident developing the soft skills again, because those soft skills, the ability to communicate, to present, that is what gets you a job.
So I guess the government likes this profession very much because they can spend the money in advance instead of spending billions of dollars in treating people.
Correct. So that's the public health nutrition, and then you can become a dietitian where you have to do a bachelor plus a 2-year master program.
So there's 5 years together?
5 years together to become a dietitian. And the dietitians can treat people with all sorts of diseases. So it becomes, it's not just diabetes, for heart disease, for Crohn's disease, all the gastro diseases, for neurological diseases. They look after people who are very sick in hospital, people who can't eat and swallow properly. It is the dietitians who design their meals.
魔力留学深耕澳洲数十年，与各大学院系关系密切，与各行业人脉互动频繁。快关注我们的账号，咨询澳新申请吧。